just to look at breast cancers specifically, that is the second most common cancer with women in the United States, coming only behind skin cancer. Currently, the most recent statistics show that we have a 1 in 8 chance of developing breast cancer at some point throughout our lifetime.
My husband, who was a retired general surgeon who actually ran a breast cancer clinic for many years, never noticed anything wrong with my breast.
The people that only know these strong details are generally the ones who've gone through it. And so the people who don't know these things, I'm very grateful for.
Personal story, I have 2 benign lumps on each breast. I mean, they keep an eye on them. I have pretty dense breasts. I think, Kelli, you mentioned the same. So I'm like, oh, well, I should be okay. But it was pretty scary getting the results the first time. It's like, oh, boy. I was crying. I'm like, what's the results going to be? And they're, like I said, benign, but could turn into something later. So hearing your story certainly wants me to keep up on it even more so. Welcome to Dental Ailments Podcast. Today we have 3 very special guests. And if you may know that it is Breast Cancer Awareness Month, which makes this episode even more spectacular. You'll hear the stories from these 3 ladies, an especially important subject for them to talk about. So we have Jill Meyer-Lippert. She has started side effect support, and she'll tell you more about that. We have Kelli Jaecks, who is a hygienist, or still a practicing hygienist, is not a practicing hygienist, but she's on the speaking circuit. Fantastic speaker if you can ever see or hear her. And then we have Athena Gorder, who is also in the dental field. She is a chairside assistant and has done other things in dentistry as well. So we'll start with Jill telling her story and also some interesting statistics about what we're talking about today.
All right. So just to introduce myself, my name is Jill Meyer-Lippert, and I am a dental hygienist in Wisconsin, and I've been in dentistry for nearly 30 years. My mom received a breast cancer diagnosis. So I saw up close and personal as a family caregiver how badly that she suffered with side effects in her mouth. And I found it very frustrating because she approached her oncology team to ask what she could do to help relieve some of the discomfort of the dry mouth and the horrible mouth sores that she's experienced. And she was basically told nothing. There's just nothing you can do. It's part of treatments. You need to deal with it. I personally felt that she was very dismissed with it. And I very foolishly thought that now that I worked in the dental field, I was going to save the day and have all of these answers for her. And I found out that wasn't the case either, that not only my new colleagues, but when I was going to hygiene school then, what we learned was really limited on that. And it really struck me that there was a need that wasn't being met. And I had that very much confirmed with patients throughout the years, finding out that a lot of times people assume the only ones that have oral health problems or oral side effects are oral cancers. And that is definitely not the case. So just to look at breast cancers specifically, that is the second most common cancer with women in the United States, coming only behind skin cancer. Currently, the most recent statistics show that we have a 1 in 8 chance of developing breast cancer at some point throughout our lifetime as women. And there are currently 3.8 million survivors of breast cancer in the United States. So the chances of you having somebody in your practice that you are dealing with probably weekly that has experienced a breast cancer diagnosis at some point is high. So it's very important that we are aware of what some of the issues can be and how we can best help our patients.
Okay, so Jill, your story is amazing, and it's I say sometimes it's unfortunate for something unfortunate to happen for something good to come out of it. And your story tells us that yes, you have this amazing program now for these patients, like you said, were just dismissed for dealing with dry mouth and other side effects from cancer treatments.
Yes. So that really inspired me to develop an online resource. When I struggled so many years to try to find the information I needed to help my patients, I really longed to have this kind of a one-stop resource that would gather some of this information and make it easy access, not only for the patients and their family caregivers, but also us as healthcare providers to help the dental providers and the medical providers to get more on the same page. So after years of going from a volunteer program to getting frustrated with how that was going and being able to keep it going, I developed what is called side effect support, and it's sideeffectsupport.com, and it's easy access for people, free information, hopefully just fill that need that still exists quite a bit today.
Now, Kelli, hearing Jill's story, I'm sure that resonates with you, and it's Athena as well. So, Kelli, your story, if you could tell us your side, does that sound pretty familiar to you, what Jill's talking about?
Yes, I understand what Jill is talking about. In my particular case, I did not have to have chemotherapy or radiation as part of my treatment. I didn't have the incredible oral health changes that can happen, but I did write a book called Martinis in Menopause, and it's about women as we age through the menopausal years. And there is a whole chapter in there about the oral health changes that hormones themselves can cause. And it's much like Jill is referring. My story, I was diagnosed with breast cancer in November of 2019, so not that long ago. And I was shocked out of my head because I live a very healthy life and have for years. I teach on self-care. I teach on the value of exercise and nutrition and all that. But one thing, that's a takeaway is that cancer doesn't care who you are or what you have or have not done. Cancer is evil. And so I do appreciate every effort to raise awareness and to raise money for research. Okay, and I was a woman who had a mammogram every single year since about age 40 because I had always had dense breasts. And so I had a mammogram every year. Everything was fine. A couple of times in the last 10 years post-menopause, I had to have a couple of, second looks like ultrasounds. I did have a biopsy on my right breast very near to the chest wall about 4 years ago, but everything benign, nothing, just the way my breasts presented. And so then November of 2019, I had my annual mammogram, and they called me back for 3 areas to do a needle guided biopsy ultrasound. So in the middle of speaking, like I had my mammogram, I left for the week to speak. I don't know where. Then I come home and then I do the ultrasound, and all 3 of those areas came back as positive for cancer. And about 85%, Jill, you may know the statistics on this more, but at 85 to 90% of women, Athena, you may know this too, who get breast cancer get what's called ductal. So the cancer is in the ducts, one of the ducts within the breast, and that's why you can feel a lump when it gets full and grows. But I did not have ductal. I had something called lobular breast cancer, and therefore there was never a lump. There was never any abnormality I could feel in my breast. No surgeon ever felt an abnormality. My husband, who was a retired general surgeon who actually ran a breast cancer clinic for many years, never noticed anything wrong with my breast. And so it was a shock. So I had three tumors of lobular cancer, and lobular cancer, instead of looking like a round lump, looks like a spider web in the breast. So I had 3 of them in my left breast. And they call the lobular cancer sneaky cancer because you can't see a lump, right? It sneaks by oftentimes. And so I'm very grateful I had a very astute person reading my mammogram because they caught it. And so anyway, they said I should, with my type of cancer, I should have a full mastectomy. And being such a healthy person and viewing myself as very healthy, I said, no, I don't want that. I can't have that. Please, can I have a lumpectomy first? And if it shows something else, I promise for sure I will have the mastectomy. And so they agreed I had a lumpectomy. During the lumpectomy, not only was there 3, they found a 4th lobular tumor with its tendrils right next to behind my areola nipple area. So therefore, it was obvious I had to have a full mastectomy because my breast was full of cancer. So in the meantime, we did a lot of researching, of course. With Jill and Athena, when you get this kind of diagnosis, you are scrambling for information. You are looking everywhere. You are asking everyone, and fortunately, as dental hygienists and dental professionals, we know we must be our own medical advocate. So my husband and I, through a dental hygienist, she DM'd me and she said, Kelli, you don't know this, but I had breast cancer 13 years ago, and I went to this incredible hospital in New Orleans, and you must check it out, at least check it out. Now, I live in Oregon, and we have wonderful health insurance here in Oregon. And we checked out this hospital, and there's a specialty hospital in New Orleans. There's only 17 beds, and all they do is treat women with breast cancer, reconstruction, hard cases, maybe women who have had cancer years ago and their chest wall, is decimated. So they're very much specialists for women like us. So we ended up, long story short, I ended up going to New Orleans for a double mastectomy. And at the same time, this hospital does a special program it's called DEEP, DIEP. So they cut me open from hip to hip and took out 4 inches of my own adipose fat tissue and my blood vessels, and did not touch my abdominal muscle, which that was my thing. I don't want you to touch my muscle. I don't want you to cut into my abdominal muscle. And I surely do not want you to put an implant underneath my pectoralis muscle. And maybe you ladies have a different story. But for me, I'm like, I don't want that. I work out every day. I don't want anyone touching my muscles. That was my big fear. So I went there, and this specialist, that's what they did. They harvest my own tissue. And then after they've taken out all the breast tissue out of both breasts, they did skin sparing. So kept my own breast skin. I kept my right nipple. I lost my left nipple due to cancer. And then they filled up those cavities with my own fat and hooked up the blood vessels into my chest wall. And for the first 24 hours, I had wires sticking out, and they would come in every single hour and hook up this machine, and you would hear the blood vessels going psh, 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 psh. So they knew the transplant was taking. So I literally had a transplant from my abdomen into my breast skin. And so it was a 9-hour surgery. It's very specialized, my first one. And so I came out of it really great. And of course, because I had no lymph node involvement, I did not have to have chemo or radiation. But I had to have every ounce of breast tissue removed out of my body. And there's more to the story, but I've been talking for a long time. So maybe when next time we come back around, I'll tell you about I do have negative symptoms, like Jill was referring to, just not in my oral cavity, but I have a lot of negative symptoms I have to now manage and deal with, hopefully only for 5 more years, but we'll see. So I'm cancer-free, hallelujah. And I had to do a second surgery last August in the COVID. I had to go to New Orleans again during COVID because they had to do some reconstructuring, and once it settled and get everything symmetrical. And I don't have a left nipple yet, but I can go back and they can try to make one. And I'll stop talking for now.
No, that's all right, Kelli. No, I'm so intrigued by you telling your story, and you've been on the show before, but when you were talking about lumps, I never thought about the spider-like cancer.
Right.
So that
you can't see them. You can't feel them.
That was new to me. So I was like, oh, you assume, I don't feel any lumps, I'm okay. But no, another reason.
Yeah, that's why it's important that not only we do our own self-exam every month to see if we have lumps and changes, but also we get the annual mammogram, because sometimes that's the only, device that would see it.
Right.
And I wanted to say, hopefully we can put this in show notes. I have a whole series on YouTube that I videoed my entire journey, pre-surgery, post-surgery, pulling out drains, scars and all. So we can put that in show notes so people, if they would want to, and I did that because when I was looking for information that first month and a half, I stumbled across a YouTube channel of a woman who had done that same thing. And I watched it all, and it's like, I'm going to do that, because if I can help one woman sharing my story, then that's what I want to do.
We'll put those in the show notes. Yeah. And we can share them on our site too, right away, because the sooner people see it, the better, right? The more, if we can save even one person.
Right. Well, that's so awesome. You did that. Put your heart into that for sure. Now, Athena, So the stories you've heard, I'm sure you can relate to some of that.
Yeah, absolutely. One thing that I did want to mention is that during the statistics that were being said is that skin cancer is the number one cancer for women, and then number two is breast cancer. There is a huge correlation between the two. So once somebody has breast cancer, they have a 50% higher risk of developing skin cancer and vice versa. So that's a pretty big thing, really big thing. So anybody who's had skin cancer, they're more susceptible to getting breast cancer. I think that's important for women to know, and for men, because men do develop breast cancer as well.
So when did you go through treatments and get the diagnosis?
So I actually hadn't had my mammogram until I was 47. And the reason being is that the care provider that I was going to said that my tissue was great. I never had any family history of breast cancer. And so she felt that doing it at the age of 50 was okay. And so I went with that for quite a few years. And something just started eating at me, just kept, that is that intuition where you just know. And I switched physicians. And the day that I went and I saw my new physician, she's like, oh, no, we're getting you in right away. So we went ahead, didn't feel anything. Everything seemed normal, but we went ahead with the mammogram. The mammogram that I had, the technician told me that it was more than likely that I'd be called back for a second mammogram with the radiologist because they're establishing baseline. So not to be worried. So I get my call back from the radiologist, and she says she'd like to bring me back, but she did see 3 areas that she was concerned about that were asymmetries were found in calcifications. So went ahead, got the mammogram. They did an ultrasound, and they came in immediately and said, we need to biopsy. And at that point, I'm sitting in the changing room going, do I call my husband at work? Maybe it's nothing. Maybe it is. Yeah, we're just going to go, just going to do it, And so they were able to do one of the biopsies right then and there. And that was a needle biopsy through the ultrasound. And then they had to bring me back later on that day to do it's an MRI biopsy. It's still a core biopsy, but you have to lay on a bed. It kind of reminds me of working on a car, because you're laying in this bed on your stomach. Your breasts are in these 2 holes, kind of like when you get a massage, how your face goes through that. But this bed rises up, and the doctor is working underneath like a car. But you hear these vacuums and these suctions, and you have the MRI and everything going, and they're numbing you up, and there's so many sounds that are happening, and you hear that almost echoing as everything else is running through your mind saying, what if? So we finished those up, and she says that she was hoping to get the biopsies back between 3 and 5 days. But this was kind of just at the start of COVID. There was no mask mandates. There was no travel restrictions. It was just kind of starting to trickle in. So it was at the end of January of 2020. And I went ahead and just kept doing everything that I do. My daughter's 28th birthday, I took her to Vegas. She'd never been there. And I was expecting the call. And we're sitting in Treasure Island, and we're getting ready to walk across the street, and we're by that big boat that's there, and I get a call. So I said, honey, I got to go back in. And she's looking at me, and I point to one breast and I give her the thumbs up. I point to the other breast and I give her the thumbs down. And she turns around, and I thought, oh my goodness. So I go outside, and her hand is cupping the breast of this boat and the mermaid that's out there. And she says, Mom, I support you. And we giggled and we laughed, and we had an amazing trip. We went back to the hotel, and I made all my phone calls. I called my husband. I made all the phone calls, all the arrangements for my appointments, and everything snowballed so quickly. It was faster than I could even remember. I met with my surgeon first. I met with my oncologist next, and then I met with my radiation oncologist. I had a nurse navigator. And at that point, I was able to have family members with me. So I had my husband, my son, and my sister to all of those 3 visits. And then all of a sudden, it was all shut down at the time I had to do my surgery. And at that point, they were allowing 2 people in. And they knew that before my surgery that my tumor was approximately 1.3 centimeters. And they knew that it was hormone positive and HER2 positive, which means they call it triple positive. And what that means is that the HER2 positive is a protein that attaches to cancer cells and normal cells, and it makes it grow quicker. So my cancer was a very fast growing aggressive cancer. So when I had the surgery, my tumor ended up being 2.4 centimeters, and there was only 3 weeks in between that time that it had grown that much more. So I was staged at a 1A prior to surgery, and then I was staged at stage 2 after surgery. Grade 3, which is the highest, most aggressive grade that they give a tumor. I was really fortunate that I did not have any lymph nodes that were involved. So when the tumor was removed, the margins were clear, meaning no cancer was outside of the surgical site. But because it was very aggressive and because it was HER2 positive, I had to undergo chemo and more than likely radiation. If I was to do a mastectomy, it was maybe radiation, maybe not. It just wasn't, we didn't know until after all the surgery would happen if I did the full mastectomy. With a lumpectomy, I had to have radiation no matter what. And, radiation, I think for all of us being involved in dental and, going to school and understanding radiation, there is many latent effects to radiation. And I've been out for over a year and I'm just starting to feel new symptoms coming on from that. I was more frightened to do the radiation than I was to do the chemotherapy. And I think it's because we talk more about chemotherapy and the side effects and what people go, and we see that more on TV, I think. With radiation, I don't think we talk nearly enough about what that does to our bodies, because it's very hard on our bodies. So those are the things that I went through, and I decided to do a lumpectomy. And because I didn't know if I was going to have radiation or not, so I figured, you know what, let's just do the lumpectomy. Let's see what we can do from there. And so I went through 6 rounds of chemo, 3 weeks apart. I explain that to people being, if you've ever had the flu, where your body aches and you're nauseous and you have GI problems, you've ever had the worst hangover in your life, and put those both together and times it by about 100. It is very hard. The radiation, I did 21 rounds, 5 of those being boosts, which are extra concentrated radiation. It's targeted just to the area itself. And those are every single day. That's 5 days a week. And you think you get tired just from going to the doctor alone. You get really tired and your skin burns. And you become blistered. And, it's just like, it is the gift that keeps giving. It really is. And, it's no gift I'd ever want to wish on anybody. And I think that's ladies who have had breast cancer or have breast cancer. We know so much about it. And some ladies do get a little bit upset when people come up to them and they state facts that aren't correct, or they say things that are maybe hurtful. But I actually think it's good when I hear that from people, because the people that only know these strong details are generally the ones who've gone through it. And so the people who don't know these things, I'm very grateful for, because they haven't had to go through it. And this is what October is about. It's about awareness and letting people know that this is out there. Let's protect ourselves. And I want to see research and everything going towards metastatic breast cancer and a cure for sure. So that's, I'm out. Also, I was going to say with hormone blockers too. Since I'm hormone positive, I have to take hormone blockers, which I still produce estrogen in my body, but it inhibits it from entering the breast tissue. I have to be on that for 5 to 10 years. And it actually puts you into a chemical induced menopause, but they take my blood and check my hormones and I'm not in menopause, but I'm still getting all the hot flashes and the fatigue and everything else that goes with that. And so, that book, I'm really interested into reading that book, because there is definitely, I think, a lot of information in there that can also help make us feel validated and even gather more information about knowing what it's like to go on this inactive chemo that's also a hormone blocker too. It also focuses on, it pushes the estrogen to the uterus, to the cervix, and to the ovaries. So now I am also at higher risk for those cancers too. So again, the gift that keeps on giving.
Well, thanks for telling your story,
Yeah.
Athena. It's, I have a friend who went through treatments as well, gosh, probably about 7 years ago. And you're talking about hormone therapy. It sounds really familiar.
Yeah.
She found hers pretty late as well. She had a golf ball size lump. She had a full mastectomy as well. And so, Jill, listening to Athena and Kelli's stories and the side effects, and what kind of products do you offer with your program?
Well, there are a few qualities, I guess, that really made me focus in on certain things. Obviously, the dry mouth is such a common complaint, not only, with the chemo, but the hormone therapies, just the whole process. And a lot of times there can be other medications that go along with it. There's sometimes steroids that go along with chemo. There are sometimes antidepressants, the pain medications. All of these things can have dry mouth as a side effect. And the more that you take, it just compounds it, the issue. There's also the risks of oral mucositis. And as Kelli mentioned, like the burning mouth syndrome and some of those types of things, that having products that are free of irritating detergents like sodium lauryl sulfate, no alcohol, no whitening, triclosan, all of those types of ingredients that may not only help to encourage dryness of the tissue, but actually irritate tender tissue and start that inflammatory process that makes them more susceptible to developing the oral mucositis. Also just, something really simple like an extra soft compact head toothbrush, allowing people to have the best access for plaque removal while preventing tissue trauma. And something that I really tried to focus on too is affordability. I think having not only my mom had cancer, my dad passed away from cancer, having that in your family, I think makes you very aware of they actually call it financial toxicity, because a cancer diagnosis can be absolutely devastating to a family. So having those resources that are gentle, are effective. And that's the one thing with, like dry mouth, there's no one size fits all. So I think they have to have options, things that they can try to say that at this point in my treatment, yep, this works great for me. But now, a little ways down the line, my body chemistry's changed. My medications have changed. Now that product doesn't necessarily work as well for me. What else can I try? And it's kind of a back and forth and a trial and error, trying to figure out what is best for that person at that particular time. So, and then also I just added teledentistry services to my site. So now if somebody does not have a dental home to have a concern checked out, or perhaps they're in the middle of treatments and it's not safe for them to actually be seen in person because of blood counts being so low, they want a second opinion, anything like that, they can actually access a virtual dental consultation 24/7, 365 days a year at a very affordable price. And I added a partners marketplace that'll help to, and that's very new, but it's going to help offer different products and services that I can't personally offer, but I want people to know that there are other options out there.
So Kelli, so talk about your books in the YouTube.
Oh, okay. Well, right, to Athena's point about putting her back in menopause, even though, there's no test, right, to say you are, but you definitely are, because all menopause is the changing hormones. And that's why we get all these symptoms of the hot flashes and the depression and the lethargy and all of that. And it's interesting to me because I wrote my book, Martinis and Menopause, after I'd been through my first natural menopause, like every woman who doesn't have surgery or cancer to the uterus or ovaries goes through. And I now talk about I'm in my third menopause. And that's one of my speaking points, because prior to my diagnosis, I was on a very low dose of hormone replacement therapy. I like what hormone replacement therapy did for me, for my clearing of my brain, for my energy levels. And so I had that November day when I was diagnosed, I had to stop hormone replacement therapy immediately, because Athena, my breast cancer, also was estrogen and progesterone positive. And so I was thrown right into menopause like the next week, because my body was trying to shift with no hormone on board that I'd been on board, right? Any woman who has even had birth control, it's the same type of thing. You don't just come off it. Like, you have to wean because your body is changing. So that was my second hormone. Then they put me on a medication that helped me because I was hot flashing like crazy all through November and December, and my lumpectomy surgery, it was a mess. So they got me on a medication for that, and we got that under control. Then I had my surgery, my big double mastectomy in February, and like you, Athena, I am on the long-term anti-estrogen medication. It's a little yellow pill. I take it every morning. I have a love-hate relationship with the little yellow pill because, yes, it dampens any estrogen my body would try to make. But what I think is also not talked about enough in our culture, which is why I talk about the menopausal woman, is because estrogens in particular, they keep us young. They keep our bones strong. They keep our brain firing, every neuron firing. We have estrogen receptors in every tissue in our body, including our gingiva, which is why we get the oral health symptoms as a cancer survivor or as a menopausal woman, because we have no estrogen to fill the receptors like a lock and key in the gingiva. So it's very scientific, real why we have these symptoms. But so for me, having to take this anti-estrogen, I said hopefully only 3.5 more years, because I've been on it 1.5 years. But Athena, I may have to go more than 5. They always reassess at the time. But I hope for only 5. So things that no one talks about, and I'm sure you can relate, Athena. I have joint aches and pain. I have never in my life had joint pain. When I get out of bed in the morning, I feel like I am 95 years old, and my feet literally creak and my heels ache when I first start walking in the morning. I suffer from neuropathy, which as tingling in my hands, like burning, wakes me up in the middle of the night, my hands on fire. What else? Oh, what else? Everything's dry. The eyes, the skin, the vagina.
You're a hot mess.
Dry because you have no estrogens to help you do anything. And a woman who undergoes breast cancer immediately is at a higher risk for osteoporosis and weak bones because the estrogen is leached out of our bones. So it's a lot of good news, so that's why I try to just be real about it, and I try to laugh and realize, I'm alive. Athena, what you mentioned about your daughter, my kids are also grown, of course, when they were in their late 20s, early 30s when I was diagnosed. And I think also we forget, Jill, this, how it affects your family. They're so afraid, they're going to lose you. And it's good that we can all sit here and talk as survivors, right? But it is a very much a shared experience that we don't talk about much in our culture and in our society. And anyway, that's what I wanted to share. I also am on antiestrogens, and it is a lifelong then management of those symptoms that come from the medication that is keeping you cancer free. So I take one little yellow pill, and then I take about 1,200 supplements a day to try to counteract the negatives from the medication. That's it.
So Athena, do you want to share some more about your journey and what
Sure.
what you're up to these days?
Yeah. So I guess I'm the medication that I take for my hormones is probably a little bit different. I'm going to guess she's maybe taking an AI, if I'm guessing. I'm on tamoxifen. So tamoxifen is made for premenopausal and postmenopausal women. And luckily, tamoxifen actually helps to increase the calcium in the bones. So it helps to decrease osteoporosis until I reach what they think is menopause, and then I have to go on the other pill. So hopefully my bones are nice and strong before I go there. It's definitely a brand new life. Oh, okay. I see what you're on there, Kelli. So yeah, it is. She is just sent, and she says it's an IA, which is an inhibitor. It still acts the same as, getting the estrogen out of the body, but it acts on a different level. But as breast cancer survivors, even though I went through chemo and radiation, and Kelli didn't. We are all still learning how to live a new life. I completely relate with Kelli when she says waking up and feeling like a 95-year-old woman. Heels hurt. I get muscle cramps in the weirdest places, like in my forearms, sometimes on the side of my foot. But the joints that I've never had problems before, I get joint aches in my elbows and my knees and my hips, you name it. And then the fatigue itself, trying to fight that, you exercise every day to make sure that you're staying, healthy and trying to keep your heart healthy with it. And, it is a struggle because I am not the same person I was before cancer. And it's not just the emotional drain, it's the physical drain and everything that it did to your body, how it takes so much from you. And it does take so much from your family too. My son also is an older one. He is 22 now, but he was 20 when I was diagnosed, and he decided to quit work and stay home and take care of me so my husband didn't have to take off as much time. He drove me to every single one of my appointments. He slept on the couch because he refused to sleep in his bedroom. He was too far away from me in case I needed him. And on his 21st birthday, he didn't do anything. He stayed home because COVID was so rampant. And, at that point, but he does tell me now, he goes, Mom, I gave you a year of my life. You're on your own. So it is very, very hard on the family. And my relationship with my mom actually drifted away a little bit because she was so afraid that anytime she talked to me, that something else was going to be wrong or it was getting worse. And so it was her way of protecting herself. And I let her be. And it was hurtful at times, but I let her be because I knew that was how she needed to cope with it. And she's coming around a lot more with it and, saying, I'm so sorry, honey, but it's okay. It's okay. My relationship with my father has actually gotten better because he was on the opposite side where it's like, I need to be around you. I need to see you. So there's good things that come out of it. And I just like to really try to focus on those good things. One of the things that I really tried to do to help my family, to help my friends, is I did create a Facebook page, and it's called Athena's Breast Cancer Journey. And it chronicles from the very time of diagnosis, when my first announcement, all the way up to even now with some of the effects that I'm having and still seeing doctors and physical therapists and, medications and everything that I go through, because I do feel it is so important that people know. I don't want them to feel sorry for me. I want them to know what this is about. And I want them to have it on their mind to be able to talk to their loved ones, tell their loved ones, and be able to have that awareness the whole time. My aunt came forward to me and she says, you know what? I haven't spoken to you in 20 years. We've just played on Facebook together. And she came out and we visited. And she says, you have opened my eyes. I've had many friends that have gone through cancers of every kind, and I never knew what they were going through. And I still don't, but I have a better idea. And one of the things that I do want to tell you is that I know many people want to know, what do you say to somebody who has cancer? Don't say you're sorry, because we're sorry too. Get mad with them and say, you know what? Cancer sucks. That's so crappy. Oh my gosh, you have cancer. That's horrible. And you know what? That anger actually helps to get the emotion out and get that validation that we need from people that care about us.
Well, you three are certainly extraordinary women telling your stories and helping out people who have gone through treatments. I'm honored that you're on the show today. Also, that reminds me again that I have to go get a mammogram. I just got the letter, so maybe it's good timing. That a reminder to get my mammogram.
To see the video footage of the podcast, subscribe to our YouTube channel at Dental Elements, ALEMENTS podcast. To share your story, hit us up on our website at rootyouon.com, ROOTUON.com.